Okay, welcome to this session. I am pretty excited to have you all here and also to be doing this because it's been a topic on my heart for many years, and I can't wait to hear what our speakers are going to say around this expanding DHIS to outside just health. So there has been a long-standing debate in the community whether DHIS2 has now become obsolete in its reference to district health. This is primarily because the software itself has evolved into more of a data and information platform that extends well beyond the limitations and the constraints sort of boundaries of healthcare use cases. And while the community of practice is forever endeared to the name DHIS2, there's, I think, recently the renewed interest in other sectors that are allied to health, most notably education. So in this presentation, our speakers, Monica Amuha and Sophia, will take us through the intricacies of adopting DHIS2 for education, especially in the context of Uganda. We could not ask for a more qualified people to speak on this topic because Monica is currently a PhD student at the University of Oslo and also a practitioner working with HISP Uganda to support the implementation of DHIS2 as an education management information system. Sophia is going to also introduce herself briefly just before we start, but during the presentation, please use the Q&A feature to post your questions, and we will take these at the end of the session. So you don't have to wait right until the end before you post your questions. You can actually start posting it, and then I'll fill them right at the end. And without further ado, please join me in welcoming Monica Moore and Sophia to present DHIS2 for routine health data management and emergency response, a Uganda case study.
Thank you so much. I'll kick us off with a very quick introduction. As was introduced, my name is Sophia Koziakis, and I'm a newbie to the DHIS2 family. Joined as the EMIS project manager just 5 months in. So I'll be doing just a very brief introduction, giving a bit of a scope and background, and then we'll deep dive into the example of Uganda, which is one of our established pilot countries. So, I mean, to kick us off, piloting and implementing DHIS2 as an education management information system has been ongoing since 2019. So it really is 3 years of experience that's been built up. And we have 6 countries that are using DHIS2 in various ways. And these countries are Uganda, which we'll hear much more about today. But we also have the Gambia, Togo, Mozambique, Sri Lanka, and Eswatini. And during these years, we've been reusing software features, we've been reusing IT capacity that exists within the country and within the region, and we've really tried to leverage the global community. And this is something we really want to dive into a little bit more as time goes by to focus more. EMIS around the world is really at different stages of maturity in the design, in the deployment, and then, of course, the use of data. And in many countries, EMIS systems still play a purely monitoring and a statistical role. So you have the collection and reporting of head counts of learners and head counts of teachers, for example. But in others, we see much more comprehensive setups. And those are integrated with other sources of data, for example, and they really provide a much more dynamic education management solution. So helping us to think about, supporting student learning, but also very importantly, resource management. And something the education sector has seen a lot of pressure on in recent years is, of course, this push to improve their reach towards SDG 4. And this is a big push. It's ensuring that we have inclusive and equitable education, but not just education, quality education that promotes this kind of lifelong learning opportunities throughout an education trajectory. And this adds so many additional layers of complexity and pressure on an education system. We have to think about ensuring learners complete their education, but that it actually leads to relevant learning outcomes. This has been a massive learning crisis we've experienced in quite a few years, quite a few decades now. And then, of course, for example, eliminating things like gender disparities in education. So making sure that learners have access to all levels of education, no matter their background, whether they have special needs, no matter where they were born, what location, and no matter what background they have. There's been quite a few lessons so far, and Monica's going to deep dive into these a bit more for us, but just lightly as a preface, a key area for us has really been this understanding and learning of cross-sectoral work. So on the one hand, how can we learn from you all and the health sector and this decades of work done? But also, how can we connect between health and education? So for example, school-based COVID surveillance, which we'll hear a bit more about in Monica's presentation. Another area has been these additional requirements to improve the system, because we have to be thinking about individual learner and teacher tracking. This is really critical for the education sector, because we're moving away from just universal access to education, actually thinking about the quality of the experience. And then finally is just the sheer volume we're dealing with in education. So thousands of schools that might close down completely all of a sudden and then start up again in a couple of years if the Ministry of Education takes over, for example, and reinstates the school. But we really believe that the more we're learning and the more we document, this kind of the DHIS2 core will really benefit from the different education use cases. So before I cross it over to Monica, it's really with a thanks to NORAD and our Global Partnership for Education, our KICS mechanism, for catalyzing the amazing work that's being done by the Ministries of Education in country and all the different departments, the local partners that we're working with, which has been really exciting, and of course the various HISP groups in country. So I think right now we zoom straight over to Monica so she can give you a bit more context about implementation in one of the 6 countries. Thank you.
Thank you very much, Sophia. Thank you, Bissau, for the introduction. So just heading over to the Ugandan use case. In Uganda, DHIS2 has been used as a decentralized education management information system for routine education data management and in the wake of COVID for emergency response. So basically our presentation will share how it has been used for routine education data management as well as emergency response. So just a brief background to DHIS2 for education in Uganda. Our strategy has been 2-pronged. One on the routine education management, where we have it implemented as a decentralized or district education management information system. We call it DEMIS. And here we had, in order to implement this DHIS2, we had various stakeholder engagements with the Ministry of Education leadership, with the district leadership and various partners. Right now we are implementing in partnership with Save the Children Uganda, and what we went ahead to do is customize the DHIS2 for education. Here we got the annual education statistical forms that collect data on an annual basis, and we customize them into the DHIS2. So we're able to enter historical data way back from 2017 to date, and this data is now available into the DHIS2 for analysis and information use. Then, of course, we had to build capacity, both at central level and district level. Whereas our focus is at district level, we built capacity at district level to enable the district education officers and planners and the entire education team to be able to use this data for their day-to-day planning for the education sector and in their districts. At central level, we had to build capacity for the Ministry of Education team to be able to sustain this system and support the district teams to use the DHIS2 for education. So we built their capacity, and right now they are able to provide support to the district teams. And of course, we set up the districts with the relevant infrastructure, the computers, the internet, and ensured that they were trained on how to use them, and they are able to access the system at their various districts. Then the other strategy now, like I mentioned, during the wake of COVID, given the flexibility of DHIS2, we said, okay, how can DHIS2 be used for to respond to the COVID pandemic. So here we are piloting a school-based surveillance, and this is within the DHIS2 as well. And we are looking at strategies of how to link all this data with the health sector. We are piloting in 2 districts right now for school-based surveillance, and we've developed an implementation plan excuse me, to support the national scale. And right now, the schools have been closed because we've been going through several waves of the pandemic. Right now, we are in the 2nd wave. It has come down, but the schools are still closed. But prior to the closing of these schools, were able to collect vital data that informed the development of the implementation plan. And this now is going to support national scale once the schools reopen in January next year. And we are looking at how to integrate this data that we are collecting in the school-based surveillance system with other existing surveillance systems, both in health and in the education sector. So this has really strengthened the cross-sector linkages, as I will elucidate later on, between the education and health sector. So just moving on to the strategy for routine education data management using DHIS2, what has been our implementation progress to date? Right now, we are implementing in 10 administrative district units from 4 districts in Uganda. Uganda has a total of 135 districts. Of course, it's just a drop in the ocean, but I think this has proved to work, and it's being taken up by other districts. So the districts are both urban, peri-urban, and then rural, to give us the different experiences in all these districts, given the challenges in these various districts. And the beauty with DHIS2 for education, what it has helped us to do right now is support us also in alignment of ad hoc data calls to DHIS2 for education. Previously, before COVID, our education management information system has largely been centralized at the ministry level, and data would be coming in from the districts to the ministry and then analyzed. But at the wake of COVID, there was need for more data, and several data calls have been made to the districts to provide data. So what we have done is harmonize all these data calls and ensure that all the data that is collected is right now relayed into the DHIS2 for education. So over and beyond the 4 districts, we are able to see that we have national data that can be used in the COVID response. Then during the implementation, like I had earlier indicated, we customized the annual IMI statistical form. But right now, we have shifted, or the DHIS2 for education has given us an opportunity to shift from annual to routine data collection, perhaps timely data collection. So this provides more reliable data on a more frequent basis to the districts for their planning and resource allocation at district level. And in so doing, we have harmonized the Ministry of Education and partner data needs, because we know that the ministry has various departments and there are various education development partners that require data. But all these data needs have now been integrated into one harmonized data collection tool that will be piloted once the schools open. And then, of course, in order to scale up from the 4 districts across the entire country, 135 districts, we've been able to engage the Ministry of Education and its development partners to support scale and sustainability of this implementation strategy. We've designed a costed national implementation plan that that the ministry now has taken over and shared with various partners. In the health sector, I would like to say that DHIS2 for health has been implemented in Uganda for the last 10 years. And one of the success stories for its implementation was partner engagement and support. All the partners pulled resources together. So learning from health, we want to engage the education development partners so that they can support the scale towards national scale of this strategy. And of course, based on the learnings in the 4 districts, we are also advocating for change in the EMIS policy, the Education Management Information System policy. Right now at the district level, there is no dedicated data manager. But learning from the health sector as well, during the implementation of DHIS2, we had adoption of new HR into the health structure of district biostatisticians. So these have been very pivotal in data management in the health sector. So we want to borrow this learning in the health sector and translate it to the education sector and see how this can be adopted and through the influence of the EMIS policy or changing the EMIS policy. So to give some examples on how the DHIS2 for education has been used for routine data management, some of the use cases that we have seen in the districts we are implementing in, we've seen that data has been used for evidence decision making at district level. Right now, the districts are really empowered to use the data. Like I had earlier said, the data was, we entered legacy data way back from 2017 to date. And so they have data, they have the historical trends, and this data has been used for planning and budgeting, where you have, for example, the enrollment figures or used to inform allocation of capitation grants to the various schools based on their enrollments. We are having the data analyzed, for example, the pupil to classroom ratio, pupil to toilet ratio. So you're able to see which schools lack classrooms or need additional classroom blocks, which schools need additional toilets. So this has really informed decision-making at district level, as well as allocation and transfer of teachers based on the key indicators that are really calculated. And also, given that we have limited funds, really, it has provided the opportunity to do targeted monitoring and supervision in the districts. So another use case that we've had an experience with is that the data has really been used to inform implementation of health programs. And like Sophia said, we are looking at strengthening cross-sector synergies between health and education. We well know that for immunization to be successful, we need targets. And these targets are really contributed to by the learners. And so we've had the enrollment data be able to provide these immunization targets. In 2019, we launched a measles rubella immunization campaign, and the districts where we are piloting were able to provide very good targets that inform the immunization campaign, planning of the vaccinations, and ensuring that the supply chain was ready, that the vaccines were readily available in the desired quantities. Then we've also had the HPV vaccines for young girls, and this has also provided, this data provided targets for that immunization program. And then, of course, we are having other strategies, health strategies such as deworming, HIV program, which learners are infected or affected by HIV, and all this information has informed implementation of these health programs in schools. Then, of course, the other thing that this implementation of DHIS2 for education in Uganda has enabled us to do is support or give us the opportunity to integrate data from existing systems. We well know that in order to calculate indicators such as the gross enrollment ratio, net enrollment ratio, or performance index, we need data on population data for the gross enrollment ratio, and then examination data for the performance index. And all this data right now is available in other national systems. So we have been able to integrate this data, import it into the DHIS2 for education, so that we are able to calculate these indicators, which are key in informing the performance of the education sector, performance of the districts, and you're able to provide targeted support and to these various districts. So this has really given us an opportunity, and we look forward that in future we can just integrate seamlessly without having to import this data from the various systems. Then moving on is that, like I had earlier indicated, where we have developed an integrated data collection tool that will be implemented on a timely basis. So from the various engagements and trainings of the Ministry of Education teams, the district teams, as well as partners, we saw that there was disaggregation in data collection. Various departments at the ministry were collecting their own data. They had their own monitoring tools. So this prompted us to further see how we can harmonize all these various needs of the ministry as well as the education development partners into one integrated tool. So this has really supported and removed or alleviated the need for various data collection processes by the various departments. And so this harmonization really optimizes the limited resources that are available and avoids duplication, as well as increasing the data collection burden at the district. Then the other thing, or the other beauty of DHIS2 for education, is that it is being used right now as we're trying to see how it can be used as to harmonize the institutional master list. We well know that the master list, or the school master list, is a living document. Schools will always close, new ones will always open up. But this has given us an opportunity, especially during the data calls, to see how this list is continuously updated in the DHIS2 for education. So like you can see on the right, we have an organization tree or hierarchy of all the institutions or schools in the country, and all these are periodically updated once we do the data calls. And this is really important because this data, or this updated list, is important to inform the Ministry of Finance in Uganda to allocate capitation grants to the various institutions. And so we are trying to see how can we continuously update this list and standardize it. And with that, we've influenced the ministry now to further now develop guidelines and standard operating procedures to update this master list. Then, of course, what you can't see, you can't define, or you can't know that it is existent. So the DHIS2 for education, with its robust analytics and beautiful dashboards, we've been able to configure them with these key education indicators. And so at the district level, at the Ministry of Education level, these dashboards are available, and they display this data, as you can see in the pictorials. So at a snapshot, the district or the ministry level central leadership is able to see the performance of the various indicators across the country or within their districts. So moving on to the sharing the emergency response data use cases in Uganda. And this was really triggered by COVID. And one of the things that we did, like I had earlier said, we've been able to harmonize or align the various national data collection, national data calls. So one of the data calls was on that it required schools or districts to provide data on key statistics on their availability, the availability of wash or water, sanitation and hygiene at schools, the enrollment numbers, the teachers, and this data was supposed to inform the reopening of schools. That was after the first wave, once the government decided to open up the schools before closing them during the second wave. So we found that this data was really instrumental in informing the reopening of schools. Were able to distribute temperature guns, masks, and even install wash facilities and build additional facilities in various schools based on this data. And during the lockdown as well, this data informed distribution of self-study materials because it provided reliable or up-to-date enrollment data on how many learners we had in schools. And of course, because, COVID brought a new whole change in learning, we had to have self-study materials, homeschooling. So we had additional partners really coming in, and this data informed lobbying for additional resources that would maybe provide more self-study materials and also wash facilities in these various schools. Then the other data call was on teacher data. So we had teachers' data being collected from all the districts, and all this data now has been imported into the DHIS2 for education. And this has been is a prerequisite right now to inform teacher vaccination against COVID that is ongoing prior to school reopening. Also to note is that the private teachers, of course, are not on the government payroll. So basically during the lockdown, they are not working, they're not being paid. But with this information, they've been able to be supported during the lockdown with food relief items, as well as some resources. Then lastly, like Sophia had indicated, we have implemented or piloted the school-based COVID-19 surveillance system using the DHIS2 for education. And now this in this system is that we are having the learners and the teachers that are screened on the daily basis. All this data is aggregated and submitted through a toll-free SMS. It's short-coded and submitted into the system through SMS-based information messaging. So you find that this data now is available into the system, and we've been able to generate real-time national and district dashboards of this data showing key statistics or key conditions or key symptoms or screening parameters for learners, like how many learners had temperature above maybe the 37 degrees, how many learners were screened for flu or had flu, and anything outside the normal range is indicated and relayed to the various health facilities or to the various district teams for follow-up. So we've been able to improve really the district linkages to the linkage to the district health teams, and also these learners that maybe are suspected of COVID are able to be followed up and linked to the various health facilities. So this is really going to be a prerequisite for school opening. All schools starting in January, once we've opened up, are going to be required to be reporting on this information, either on a daily basis for suspected cases or weekly basis for the aggregated data. Yes, so this is very instrumental. So basically, those are some of the use cases that we have used the DHIS2 for education for in Uganda. And just briefly on the lessons learned, we've really realized that decentralization of education data management improves utilization of data at lower levels, and this has really been at district level where we are focusing our implementation now. We find that the district teams are really empowered to use their data for routine planning. Then, of course, the integrated data collection and reporting needs for both partners, the districts and the ministry, minimizes duplication of reporting and wastage of limited resources, like in this low income country like Uganda. And then strengthening the DHIS2 for education has really strengthened the linkage between the education and health sector. So this data is really critical for successful implementation of health programs and response to emergencies. I think COVID has proven that it's more now than never that we need this linkage between health and education to be really strengthened if we are to be successful in attainment of these SDG goals. Then, of course, partner support is very critical for national scale and sustainability. So we are really urging different partners to support this scale and seeing also how all these DHIS2 for education activities can really be integrated into the national strategic plan for the education sector moving forward. So with that, that has been our story in implementing DHIS2 for education in Uganda. And I would like to acknowledge the Ministry of Education Uganda that has really taken on its stewardship role in implementing this for the last 2 years. And we've been implementing in partnership with Save the Children and HISP Uganda, with support from University of Oslo and funding from NORAD and the Global Partnership for Education, the KICS program. Thank you very much.
No, thank you, Monica Amuha and Sophia Kusiakis. Thank you so much for that presentation. We already have some questions lined up. I have a few for you, and hopefully we can get through it in the time that's left. So the first question really hopefully would be an easy one for you. It's that the metadata package which you referred to that you used, is it available? Can you talk through around, if somebody else wants to follow in your path to implement something similar, where would they be able to get a hold of the package from?
All right, thank you very much. So in line with this, implementation for DHIS2 for education, like Sophia mentioned, it's not only in Uganda, it's also in various countries. So we are working with the University of Oslo and UNESCO to develop a standard metadata package for the education sector. So right now it's in development, and of course, various countries have basically now adopted or customized their own national IMIS tools within the DHIS2. So that has been tailored to various countries, because in Uganda, we are focusing on aggregate, while in Gambia, they are focusing on individual data. But all this is being now developed into standard metadata packages in collaboration with University of Oslo and UNESCO. So this will be available for various countries that would like to adopt it for use. Thank you.
No, thank you very much. And actually, so Armin was the one who asked that question, and he asked a follow-up question, which you already partly answered, which is around, have you implemented DHIS2 tracker for student level tracking, which at this point is no. So I'm going to flip that question slightly and ask you, what are the obstacles and the challenges in implementing sort of the tracker in Uganda, given that Uganda has a long history of DHIS2 at the tracker level, and why haven't you, and what factors would need to be in place for you to implement it?
All right, thank you very much, Amen. the challenge is really for Uganda, like I had indicated, Uganda, we are really focusing on the aggregate best, whereas our counterparts in Gambia have implemented, are implementing DHIS2 for education based on tracker or individual level data. So what are the differences or between the two countries? You find that compared to Gambia, Uganda is a much bigger country with a very more number of schools. So you're looking at over 5,000 or 10,000 schools in Uganda compared to maybe 1,000 schools in the Gambia. So implementing individual-based data is really in Uganda would be very expensive, because you have to build or buy the infrastructure, support data collection at school level. So given all those limited those challenges and also the limited availability of resources, we've focused more on the aggregate best, and maybe building on the aggregate and learning from the Gambia, and also having more partner support. We look forward maybe to scaling down to school level. But also, in addition, you find that at school level, there is limited infrastructure, limited internet connectivity. So it would be very challenging to implement individual-based tracking at that level. Yeah.
No, thank you, Monica. And I wonder if Sophia can speak to the idea of this EMIS maturity and funding, because in Gambia, even though it's much smaller in terms of scale to Uganda, how have they been able to get the funding for sort of even the individual level? And is it at scale? Are they doing it, in a pilot district? What are the challenges they face? I don't know how much you know about that implementation, but it would be good to know what's happening with EMIS Tracker in other countries outside of Uganda.
Yeah, absolutely. I mean, the first is, of course, the catalytic funds that we have received from a Global Partnership for Education in NORAD. So it's within the same grants. It really is about the EMIS shift within country as well. So there has been a big drive across the education sector for access to basic universal primary education. But an EMIS shift that has been happening within the EMIS policy in the Gambia has been to look more into things like learning outcomes, but also gender equality and social inclusion indicators. So it really is a big shift within the country that has pushed them to move this way. The challenges remain absolutely the same, but as Monica was saying, country size allows us to also take the opportunity in these grants in these next 3 years to really try out more in the Gambia. Also, of course, we have so much developer capacity in Mozambique that there's a lot of support to be able to help us think about, do we need additional apps where there are gaps? So Mozambique is also helping the team a lot, something that can be used in Mozambique as well, but at least can support the Gambia where there are specific gaps. But we will have a simple tracker package available this fall, and we're working on some quite complex use cases. So please do keep an eye on our work at the Community of Practice, the education thread. As we learn more, we're documenting a lot more, so we'll be able to share and keep everyone updated as we move ahead.
Yeah, thank you, Monica, and thank you, Sophia, for that response. Now, we have a question from another Monica Lopez, and these are two parts, so I'm going to ask them separately. So the first is, what are the key elements in your training that had an impact on the user's ability to actually convert that training into decision making? Not just entering data, but the training that gets them to actually use that data itself, if they are using that data for decision making. What are the key elements that you can highlight?
Yeah, thank you very much. Maybe in the trainings, really, we focus on the end in mind. And here the end in mind is the data use, basically. So whereas we are training on data capture, the end users such as the districts or the schools, we are focusing on data capture, but we really bring out the concept of data use. And so here we emphasize the use of the analytics, the dashboards, and we have use cases, exercises that that are really targeting the various use cases in their own settings to really inform them and see how now this data can be used or applied to address some of these challenges or answer some of these questions at the district level. So you find that, all the users or the district planners or the education officers have all these questions in their minds. But now when we bring it into context and share with them examples of how this data is being used, and they actually generate this data and they are able to, analyze these indicators, that really drives them to love the system and be able to use it more. Yeah.
No, that's great. And because the next question, the second part of that question was, I think mostly around the process for engagement. Was it a consultative process? Because, if, or did you present them with a relatively complete product and then just taught them how to use it? So how important was it, or wasn't it, to actually engage with these stakeholders before you finalize the customization?
Yeah, one of the key concepts that we really use is the Agile methodology, where you have to go to the users and really know what the users require. So we, in the initial stages, we did a requirements gathering process. We went down to the districts to really understand what are their data needs, how do they use the data. So this informed the configuration of the system, the customization of the system, and also the configuration of the indicators, so that this would produce or generate the data that they actually wanted to see, or the outputs that they really wanted to see. Then, of course, the various engagements, we had to engage with the district leadership for buy-in and also the central leadership. So we didn't go alone as HISP Uganda or Save the Children, but we have been going at the forefront or led by the Ministry of Education leadership. Then the other strategy really in terms of this has really been learnings from the health sector. So in all our trainings, we've really tried to emphasize the learning from the health sector, where we have the district biostatisticians that have used this system for over 10 years, come and share their experience with the education teams. So this really generated a lot of buy-in from the teams. Yeah.
Oh, excellent. I know we only have a couple of minutes, so I'm going to give you the question that you probably take 2 hours to respond to, which is typical. And that is, if you look ahead, say in the next 2 to 3 years, where do you think EMIS is going? I mean, what should we be expecting, presentations like this to cover, to look like, to sound like? I'm going to give both of you like 30 seconds each to perhaps predict the future, which is not a very clever thing to do.
Yeah, so I'll start. Thank you very much. It is indeed a hard question, but just to give a shot at it, I think moving forward or in the future, I see EMIS being used, or I'm just borrowing the learning from health. In the health sector, we have really been, the health sector is right now data driven. And it's what I would like the education sector really moving forward to be, data driven. All our decisions need to be informed by data. Sophia mentioned about the learning, the quality of learners and all that. So this cannot be achieved if we are not having reliable data available to everyone who needs to use it at the right time. So moving forward, I would like to see EMIS or the education data be data driven. Yeah.
Okay, and Sophia?
No, lovely. I mean, just to complement, I think 2 things. One is to take a metered approach and to make sure that we have a tiered, phased approach to this, because it can very easily jump to very complex, very idealistic visions. whereas we need to make sure that we have the foundations and the basics set. So I think it would be really, really important for the different countries that we might work with in the future as well to be able to say we can do the foundational basics, but then we can also do the idealistic dream, which is where we're heading to, what Monica was saying in terms of quality education. But I think a key thing as well is about the stakeholders. So a big push for quality education in many of the countries we work is the community, so that parents and community members are able to keep accountability and transparency for quality education. So being able to visualize things in a great way so that all stakeholders can engage with and have a role and responsibility in the education of their children and youth.
No, thank you so much, Monica and Sophia. So Monica, you're saying we want a purpose-driven educational system, and Sophia, you're saying that actually to move away from output and move towards impact, the quality, not just counting how many, but the impact of education, and that's where we want to see EMIS going in the future. I have to thank both of you again for treating such an important topic. Sophia Kusiakis and Monica Amuha, thank you very much.